I want to welcome everyone to the webinar, The Pursuit of Happiness, Personal Well-Being, and the Management of Stress. My name is Dr. Jamie Barges. I'm the Director of Technical Assistance and Research at NCUIH, and I'm very happy to be joined by our primary presenter today, Annie Lowe, who is a master's in social work that has been interning with us at NCUIH, working on reviewing the literature and pulling together the knowledge base around happiness, well-being, and stress management. We are excited to have Annie with us. She actually comes directly from one of the urban Indian health programs where she supported a Strong Families Project, which is a home visitation program with the Native American Health Center in Oakland, California, as an intern there. And so we're happy that she's been able to work with NCUIH in the upcoming 6 months to really support us in our efforts in working with you all in addressing issues related to stress on the job. Now, one of the things that I did want to share before we get started, we have quite a bit of information to present to you. This is the result of a literature review that Annie did in the scientific literature, looking about what we know about what stress and well-being and happiness is. What are some of the effects of stress on our bodies and on our minds and other facets of our life, as well as what are some of those things that you can do to really support the management of stress both in your work and in your life. And I do want to comment that this particular webinar is the first of what we are planning for as a series of webinars that's focused on these kind of workforce development issues. And the reason that we're doing this is because it's coming directly from many of the staff at the urban Indian health programs, as you guys are dealing with a population of people that are addressing a lot of health disparities or experiencing a lot of health disparities. And we know that your programs are oftentimes underfunded, and many times you guys are asked to wear multiple hats. And we couldn't help but notice on our site visits, coming to visit you all and meeting with staff and other folks from the urban Indian health programs, that stress is a really huge issue, and it is impacting our jobs and our work in many ways related to turnover, overall well-being, and even our productivity. But the nice thing about this topic is that not only does it support us in our work endeavors, but it can also have a huge benefit in our personal and family lives as well. So we hope that you all appreciate this topic area. We're very excited in presenting it to you today. And to get started, Annie, if you could advance to the first slide. Talk to you all a little bit about what the learning objectives are. The first part of this webinar will be to define happiness, well-being, and stress. We want to make sure you understand what we mean by that. The second is that we're going to talk a little bit about the effects of stress on individuals and families. And again, not only is this important for you as an individual, but these concepts can also be applied to many of the individuals and families that you're serving through your work. And then third, we want to talk about what are those effective strategies that have been found in the research literature for mediating the stress response and promoting the well-being of people. So now these are our learning objectives, but we pose a question to you: what are your learning objectives in joining this webinar? And we're hoping that that you have some personal and maybe even professional objectives regarding this topic, and that hopefully that we'll be able to speak to those objectives as we move through this presentation. Next slide, please.
So we'd like to start with some definitions of happiness and stress. Happiness and well-being have a lot of different definitions, and some of the original ones in the literature were around hedonism, which is just that feeling of pleasure and no pain. Another would be like desire as a measure of happiness, how we search after things that we want. And then an objective list being something that sort of society has decided is a worthwhile pursuit, and we have achieved it. And so then authentic happiness is a version of all three of those things, being something pleasurable, and you're engaged, and you're finding meaning in something larger than yourself. Another common term we'll use is subjective well-being, which is people's sense of wellness in terms of their feelings and thoughts, about their lives. And this includes satisfaction with life, job, relationships, and your positive and feelings around that. So then stress and trauma. Stress, pretty common term we've heard. Any demand or change that the human system is required to meet and respond to. So a stressor causes stress. And stress can be good, or if it lasts too long or occurs too frequently or it is too severe, it becomes de-stress, in which case you're out of control to some extent. And then traumatic stress would be when our reaction to any challenge or demand or threat exceeds our ability to cope with it, resulting in de-stress. So the biological part of our stress response is the autonomic nervous system. The sympathetic part is the part of us that prepares the body for fight or flight in response to a stressor. So in nature, this would be like, oh, I'm running away from a bear, because the bear comes and my immediate response is quick. I'm going to accelerate my heartbeat. I'm going to slow down digestion because I need to use all of my energy to run away from the bear or fight it. And it's going to stimulate all of those stress hormones. And then all of my energy is going to be released into my bloodstream. And unrelated, the sexual response will use both of these, actually. But parasympathetic then involves the opposite of sympathetic. So once the bear is gone and I'm recovered, my body's going to want to recover from the stress of seeing the bear. So my heartbeat will slow, digestion will happen again, all of the opposite hormones get secreted, and my tissues will recover and my bones repair.
Okay, so for this next slide, we actually wanted to do an activity with you all to try to help bring home the point about the activation of the autonomic nervous system. And we really wanted to simulate the fight, flight, or fright, which is your sympathetic nervous system. That's what gets you up and moving. And then we also want to kind of talk you through how to bring yourself back into check to focus on recovery and growth and in your activation of the parasympathetic nervous system. So this may be a little silly if you're in a cubicle, but we are going to ask that you participate. So the first thing we're going to do is we're going to work to activate your sympathetic nervous system. So what I'm going to do is I'm going to ask you guys to all stand up in your offices, find a little space for yourself. Make sure you've got plenty of space on the floor around you. And you can either do jumping jacks or you can just run in place as briskly as you can, run in place. And we're going to do this for 30 seconds when I say, when I tell you to begin. And at the end of that 30 seconds, we're all going to come back together, and I'm going to talk you through some deep breathing to bring your parasympathetic nervous system back into place so that you can bring your system back down and start with that kind of growth and recovery piece. So so everybody stand up, and on the count of 3, 1, 2, 3, go. Run, 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 run. Jumping jacks, whatever it is that you feel like you need to do. We're going to keep going for 30 seconds. You're 10 seconds in. Good job. Keep it up. Now you're at 15 seconds, halfway there. Keep going. Here we go. 5 seconds. 5, 4, 3, 2, 1, stop. Okay, now everybody should feel their heart rate up. You should feel the energy pumping through your system as just like you were running from a bear. Now again, remember, this happens in any kind of stress response. It could be running from a bear. It could be something tragic happens at home. It could be you got startled by a car that pulled out in front of you. It could be a lot of different things. So go ahead and sit back in your chair, and I'm going to talk you through some deep breathing. Now, I'm going to talk you through the process, but the most important thing to remember is that when you fill up your air with lungs, you're going to hold it for a little bit, and then you're going to take a very long time to exhale, twice as long as it took you to pull that air in. So go ahead and inhale, deep breathe, fill your lungs up, fill your your entire lung capacity up with air. Hold it. 1, 2, and slowly, slowly exhale that air out twice as long breathing out as it took you to inhale. Now deep breath in and feel your lung capacity up. Feel your lungs expand, expand. Hold it. 1, 2, and exhale as slowly as you can, twice as long as it took you to bring that air in. We're going to do this one time more. Inhale. Feel that lung capacity up. Hold it, hold it, hold it, and slowly exhale, making that exhale twice as long as it took you to inhale. And the reason why I hope you all are feeling a little bit of a calmness in your head and you're feeling good and ready to learn more throughout this webinar. But the reason why we tell people to exhale twice as long as the inhale is that by exhaling, you're actually slowing down your entire system. When you're inhaling, you actually do increase your heart rate quite a bit. So when you exhale, you want to make sure that exhale is really twice as long. And the recommendation really is that, it takes you 4 seconds to bring all the air, fill it up into your lungs. You hold it for a couple of seconds, and then you can exhale that air slowly out for about 8 seconds. So if you do the 4, hold 2, and exhale for 8, that's a good tempo for you to keep for deep breathing and relaxation.
So to go into a little bit more depth around traumatic stress, when stress really becomes too intense. So what we hear about a lot in mental health would be something like acute stress or critical incident stress, when someone is seriously threatened by harm or death. So that would be included in the PTSD definition of, or the DSM definition of PTSD, where you need one incident that is acute to cause that. And secondary trauma, which is involved probably with all of us, is around stress and trauma reactions in response to witnessing or hearing about traumatic events that have happened to others. And this can happen giving similar responses or with similar symptoms as a traditional stress response over time. So then another form of stress, cumulative stress. This might happen at work, where it's low-intensity chronic stressors that add up in someone's life. So being like, there's lots of deadlines approaching, people are feeling a little bit irritable, all of that kind of small stressors can add up to the point where they are distressing. And then historical trauma, which I think in this field we're all familiar with to some extent, is a cumulative emotional and psychological wounding over lifespan and across generations emanating from massive group trauma. So this kind of trauma can happen intergenerationally and cumulatively, and include current things like incarceration and continuing disproportionate rates of trauma and stressful events. So then complex trauma can be the accumulation of all of these things. It requires stressors that are repetitive, prolonged, and cumulative, and it's often interpersonal, involving direct harm, exploitation, or maltreatment. So that can include, it often includes child abuse, child neglect, genocide, incarceration, many, many different complex things where someone or a group of people are directly harming an individual or community. And this often occurs at a developmentally vulnerable time in the victim's life. So as a child, or when someone's incarcerated, or in some way disadvantaged in society.
And Annie, I just wanted to say I'm really glad that you presented the activity right before, which really focused on the differences between the sympathetic, activating the sympathetic nervous system, and the parasympathetic nervous system, because it very much relates to this slide in that For those people who are having stresses that are going on for a long time, and it could be ourselves, it could be our patients that we're serving or the families that we're serving in the community, when stressors go on for a long time, you just have a heightened sense of activation of that sympathetic nervous system. And I think, I know that we've got other slides that will talk about the impact of that, but it's also important to note that that secondary trauma is really something that the urban Indian health programs, and probably even within tribal communities as well, but that's something that's a real threat to us because we have communities that are experiencing such high rates of trauma that, ourselves, we are human beings first, and we can't always be immune to the effects of secondary trauma, or what we call vicarious trauma. And I know, just as my job prior to coming to NCUIH, I worked as a clinical psychologist and provided direct services and did a lot of trauma treatment. And I got to say, there were times where it did impact me, and I had trauma reactions that surprised me sometimes. So, it's important that that secondary trauma is something that we're always kind of attuned to, and we're doing some things to try to manage that, because when we're working again with high populations or populations that are experiencing a lot of trauma, this one is a really significant issue. And then it's also important to know that, especially as for those of us that are Indian people, because we've got so much trauma within our communities, we also carry with us our own historical traumas that may be re-triggered by other things that we're seeing. For example, if you're living in a community where you have a long history of children being taken into foster care, when those things happen, if you've got that long history, you may be in the community and thinking, gosh, I've got to make a report, but you have your own fear, and kind of you may even start feeling some of those sympathetic nervous system responses. Your heart beat might go up, your breathing gets deeper when you realize, oh my gosh, I've got to call child welfare, and you know what the potential outcome of that would be. So there's an example of how even things like having to do something as a part of your job could be triggered by your own historical traumas within your families and communities, and it can really impact you in terms of increasing your stress response.
Definitely. So then we wanted to talk about how this sort of chronic stress can impact happiness and well-being. So the impact of stress on physical well-being. And like Jamie said, stress can be caused not just from, oh, there's a bear here, but also, oh my gosh, I'm thinking about this exam I have tomorrow, or this presentation I have to do, or this client that I'm really worried about. And that can cause the same stress response, that same sympathetic heart racing response, just from a thought. And so what researchers have noticed is this has an impact, having your stress response going all the time, on physical well-being, of course, because your body's in that chronic state of not recovering and growth. It's in the chronic state of getting ready to go and fight. So it can increase risk of hypertension and heart disease. Your immune system tends to be suppressed because you're focusing all your energy on battling physical stressors. Some digestive disorders can be associated with or influenced by chronic stress. And it can actually change brain chemistry and synaptic plasticity, which is the ability of your brain to make new connections, or make connections between different synapses, the way it communicates to itself. And this, they think, can be changed, but it is something that is pretty dramatically seen in children who deal with chronic stress and adults who do. And of course, I wanted to note the moderate and transient stress, like you would do for fun, like roller coasters or sports or anything that kind of gets you excited, yes, but it's not the same chronic, distressing stress that would cause all these other things. And actually, the moderate stress is really great for your memory and brain development and immunity because it's sort of stimulating that for a temporary controlled period of time. And then one of the big studies that researchers have noted around what chronic stress can do to people is the Adverse Childhood Events Study, which was a long-term study that followed people from, I believe over 20 years or more. And so they noted that people who experienced 4 or more categories of childhood exposure to abuse, neglect, or childhood dysfunction, as opposed to those who had none, had these really intense increases in health risks for things like heart disease, stroke, bronchitis, and even diabetes and obesity. So there's something around the childhood stress that seems to lead to a higher risk of these physical adult conditions. And then the impact of happiness on physical well-being. So in this case, it sort of works in the opposite direction. So positive affect can be associated with healthier heart rate variability, which is one of the risk factors of heart disease. And then positive emotion is associated with stronger immune function against colds. And they're finding that optimism has all these positive outcomes on mortality, survival, cardiovascular outcomes, immune function, cancer outcomes, even physical symptoms and pain. And just to note that it's not as though optimism is the only answer to all of these health outcomes. It's complex and uncontrollable factors that often influence things like mortality and survival. And for those of us who aren't natural optimists, it's nice to know that actually we can learn optimism, and we'll talk a little bit more about that later. And the impact of stress on psychological well-being. As with the brain being affected by stress, learning and memory can be impaired by chronic stress. And again, the distressing stress, not the, oh, this is really fun for a moment stress. And it appears that stress and depression have this sort of reciprocal relationship where they've found that there's a genetic predisposition. Some people have a genetic predisposition to depression, but that's not usually turned on until they hit a lot of chronic stressors. So it seems like the stress is actually sort of the kicker into severe depression. And then it seems when you're in a depressive state, you actually have more of these chronic stress symptoms. So even though it seems that someone is really lethargic while they're depressed, it's actually their body is on high sympathetic response. So their stress hormones tend to be really high compared to the rest of the population. So that seems to show, they think, that all of those sad, guilty, self-destructive thoughts that you create when you're in depression may induce that same stress response that we would see among someone facing a physical stressor. And then chronic stress and trauma can lead to what we call learned helplessness, which is when someone has learned to behave just totally helplessly, failing to respond, even though there are opportunities for them to get out of a situation or avoid unpleasant circumstances or get positive things. So they've done studies with mice even where if the mouse is given enough stressful situations, eventually it just stops trying. And so people are the same way. If they face enough difficult, challenging situations and they don't have many resources or people to help them out, then they start to think they can't do anything, that nothing will work. And again, with the ACE study, people who had experienced the 4 more categories of childhood exposure to these different dysfunctions were at much higher risk for developing alcoholism, using injected drugs, having depressed mood, and the suicide risk was really huge. So the long-term impact of these of a number of chronic childhood stressors can really lead to some pretty negative psychological outcomes later in life.
And Annie, I do really want to kind of stress that learned helplessness thing. I think for many indigenous populations that have had lots of historical traumas, that learned helplessness becomes quite prevalent within the communities oftentimes. And, you know, again, it's that idea that, you know, no matter what you do, you feel like you can't have any effect on the outcome, and so you just stop trying. And I think we see that a lot within our communities. And I also want to note that even though for this particular presentation, we've kind of broken it up into areas of physical outcomes, psychological outcomes, which is what we're talking about now, and then social outcomes, which we'll talk about in a minute, they're all really related. So it was interesting to see on that A study on the physical outcomes that diabetes was on the list and increased risk for diabetes. And here we see some of the other really serious things related to alcoholism, drug abuse, depression, and then, you know, and suicide. So again, even though we've kind of broken them up by physical, psychological, and social, they're really very well related, and stress seems to be a very important common factor.
Yeah, exactly. They're definitely all related. So here we're looking at the impact of happiness on psychological well-being, which we can probably all predict is a pretty good thing. Optimists in general seem to have a good ability to flexibly cope with a variety of stressors and levels of control. So it's not just that they feel in control, it's that they know what aspects they can control and are able to think flexibly about different ways to cope with something. So they're very adaptive, which helps a lot in terms of facing trauma or stressors. And then a strong sense of your own ability, sort of to build on that, to cope helps with recovery after trauma. So when you have a sense that, I can get through this, I think I can, then you do most likely recover better and sometimes even learn from after a post-traumatic event. And then, as we would sort of expect, when you are happy, you tend to make others happy. So when you're surrounded by happy people, you are likelier to gain from that and become happier in the future. And luckily, we don't have to be happy all the time, and we'll talk about that a little later. And then the impact of stress on social well-being. So there's a concept called stereotype threat, which is this sort of disruptive apprehension, a stress, about the possibility that a person might inadvertently confirm a negative stereotype about one's group. So this kind of stereotype threat can undermine academic learning for people who feel threatened. For example, women in math actually have been shown that because women have the sense that they can't do as well as men, they're told societally that's their stereotype, then women who are good at math will perform not as well on math tests because there's that extra stressor going on in their brain of like, oh, I have to achieve this all better than the men who I'm doing it with because I have to disprove the stereotype. And the stress of that actually works opposite. And they've been able to take away and everyone is at an equal performing level. And stereotype threat can even spill over and impact sort of self-control in non-stereotype situations. So if a person is under a lot of that stereotype threat all the time, it starts to really stress you out. And it does the same thing that chronic stress does in general, which is impact your self-control and ability to sort of handle other situations that are stressful. And of course, elevated job stress can lead to burnout. We do have research on that. And negative feelings at work can increase absenteeism and turnover. And then poverty-related stress, another form of stress we face a lot with the communities we serve, is the stress of living with less than one needs. And then that creates that same chronic stressor, wear and tear on the body, dysregulating and damaging your psychological stress response and your psychological resources for facing that stress. And of course, poverty has so many impacts on the ways family work and are able to function, including potentially increasing conflict, family violence, substance abuse, food insecurity, residential mobility. Not that these are caused by poverty directly, but they can, because of the stress caused by poverty, can happen more frequently. And that can impact the formation of a child's healthy attachments and development because they're not feeling safe in the home, which is part of what's required for them to develop well.
Yeah, and Annie, I think that the stereotype threat is something that's definitely it can be a challenge, I think, within a lot of different communities. And there's a lot of different stereotypes out there in various places about American Indian people. And I will share a story of someone I knew. He had a real, growing up, had there was a lot of comments in the community about the cleanliness of Indian people, and he kind of grew up with this, and he would use this term, I don't want to live up to, and he's really talking about a stereotype threat of a dirty Indian, and that's what he would say. And what happened with that, that kind of thought process and that stereotype threat is that it ended up spilling over into his work situation, where his expectations for cleanliness in the workplace were quite intense, to the point that it really impacted people's ability to stay employed under him. And so that's an example of how a stereotype threat can spill over into even your work situation. And there's a lot of those potential stereotype threats within a wide range of
Yeah, exactly. That's a great example. Oops. So then, of course, happiness can impact social well-being as well. So it appears that positive affect does have good outcomes, leading to better social relationships. Happy workers are more likely to be rated well on performance. Happy people seem to volunteer more at higher rates. Positive feelings are strongly related to good social relationships, and positive mood and subjective well-being are really important for success at work. And now we're going to go into talking more about managing stress and increasing well-being. So what do we do with all these concepts? I wanted to show you a little bit of sort of a definition of stress-resistant persons and happiest people. And you can see where they kind of overlap in terms of their concepts. So stress-resistant persons having a sense of personal control, that they feel like there's a connection between what they do and how they feel, and they believe they have capacity to influence their lives. And I think optimism overlaps in some ways with that, and facing challenge with strength. And then we have the pursuit of personally meaningful tasks. They're engaged in their lives. It helps them to be active instead of just passive during times that are really challenging, making lifestyle choices, all the things we tell our clients and patients to do. And social support, they always have someone, or preferably multiple someones, who can help them deal with difficult situations. And this is a really strong correlation. And same with happiest people. They tend to devote a lot of time to family and friends, nurturing and enjoying relationships. They express gratitude. They readily offer help to coworkers and strangers. They're optimistic. They savor pleasures. They sort of live in the moment, and good things are really enjoyed. Exercise. They are committed to lifelong goals and ambitions. And when they're stressed, and this is true of both the stress-resistant and happiest people, they may have some negative affect, in which case, it's something stressful, so you're going to feel upset or hurt or sad or angry, but they face it with an understanding that they can get through it and that they're going to learn from it. And one thing we wanted to note with this is, as we're talking about happiness especially, that there's an importance of balance in terms of this whole happiness and control and emotions. And it's best to have everything in moderation. And we really don't want too much of the control or too much of the emotion. They're finding that actually, if you value happiness, that can lead to lower levels of happiness when times are pretty good, because you think you should be happy. And the whole should thing is pretty judgmental and can lead to a lot of disappointment. So it's okay if you aren't happy all the time. It's more important that you aren't judging yourself as much. And then another one, they mentioned sense of control as being important for happiness. And sense of control is good as long as you're flexible with your sense of control. If you're inflexible and you think, oh, I can control whatever happens in the future, you're also likely to be disappointed and feel judging about what you felt or what you did. It's best when your sense of control is within the context of knowing what you can control. And then same with emotions, it's best when you can balance positive and negative emotions. And we're going to have both, and both of them can teach us things. And it appears that when you have too much variability in the positive emotions, that can even lead to lower well-being and life satisfaction.
And Annie,
and then, yeah, go ahead.
I'm sorry. I think this concept, everything in moderation, even in moderation, it's something that I found on there's a nonprofit called Action for Happiness, and it's an international nonprofit that's really focused on, promoting the research and educating communities about the research base about happiness and well-being, and I, it really sticks to me that concept of moderation. It is important to moderate things, and in many indigenous communities we call that balance, and that concept of balance has been there for a long time, and I think the most important thing, particularly around the concept of self-judgment, because we do have a tendency to judge ourselves, oh, we should be this way or we should be that way, and those shoulds really do invoke a lot of guilt, maybe anxiety, other things for us, that maybe we're not in a place that we think we should be according to some kind of standard, and I think that the word balance is quite important, because balance means just that, not that you're ever perfect or that you're always balanced, it's that you're working to balance every day. So there may be some days that are down and some days that are better, and you're just working to balance yourself out, and knowing when things are stressful that there might be some extra steps you have to take to balance yourself in a good way. And so I think that in many cases this concept of moderation is consistent with the concept of balance, and it definitely has a good grounding within many indigenous belief systems.
Yeah, exactly. That's a great way to look at it. And so what all this means is kind of good news. We are complex and diverse, and we have to figure out our own way to go about wellness, because nobody's going to have the same way of doing it, and nobody's going to face the same stressors. So balancing is really important. So what if you're not a dispositional optimist? It turns out we can learn behaviors to increase well-being, but only about 10% of our happiness levels are explained by differences in life circumstances or situations, like money or status or things we're given. 40% of those happiness levels appear to be explained by behavior, so what we do. So some steps towards that. First, being patient with yourself, part of the non-judging, and we could easily throw ourselves into this wellness kick and not think about being kind to ourselves in the process. Creating a practice of being in the present, savoring the moment, enjoying things as we are. And then self-discovery and a search for meaning as a process of learning and not judging. So being kind to yourself, noticing your self-talk and thinking about sort of the reasons behind what you do, discovering where you learn these beliefs and reasons. So why are you working in this field, and what are your reasons behind doing this? And are there little judgy talks that happen in your mind while you're doing it sometimes that prevent you from really connecting with your meaning behind what you're doing. And so as you start to sort of pull apart which is why you want to do this job or these different parts of your life, and then what you might have been taught or have been told that you should do. And the shoulds, you can start teasing those out and pulling them out a little bit. Go ahead and feel grief or whatever it is you need to understand how that hurts, and then using your anger at the injustice of that hurt to push out those voices and to make sure you're really emphasizing why you're doing the job that you want to do. And creating balance in your life. Life is more than work, I think, when we do really powerful work like all of you are doing. It's hard sometimes to remember all the other things in our lives, but those are good for balance as well and will really help with our ability to work well. And everything in moderation, like we said. And of course, reaching out to others. We're not alone in this, and nourishing connection, family, and community are all really important in going through this process of learning how to be more well. So one of the aspects that came out in the research was being present and self-compassionate.
Annie.
So
Annie.
Yeah.
Can you hear me? Can you go back?
Do you want to go back?
Yes,
yeah.
Please.
I was wondering if you wanted to say
something.
I had it.
Just go back and we'll edit this out. Okay.
Okay.
So, Annie, one of the things, I thought a lot about this kind of concept of optimism, and, we all have our own experiences, different experiences that we've had throughout our lives, and those experiences do shape the way we think. But the good news is that once it's shaped in one direction, we do have the power and ability to reshape our way of thinking. And I think that's really what I'm kind of taking out of this this slide, is really that, when it comes to optimism, it really does have, it starts really with the power of our mind. And our mind is quite a powerful organ in our body. And, my grandma always said, what you think impacts what you say, and that then impacts what you do. So it really always starts right in the mind in terms of what you're thinking about. In any situation, you've got that opportunity. Even if you automatically think something negative, you have the opportunity to reframe that in your own mind and to get in the habit of practicing. And it is a skill that you have to practice, interpreting things in a more positive or strength-based way, looking for lessons, looking for blessings, really makes a huge difference in the way in which the rest, that the rest of it flows, whether it's what comes out of your mouth or what comes out of your actions or inactions. So I really appreciate this, that, because I know a lot of people say, well, I'm just not optimistic. But again, much of it is something that you practice.
Yeah. Thank you for that, Jamie. So part of the cultivating, being present, and self-compassionate, these aspects have been showing up a lot in the research. Mindfulness is a big concept now in therapies on moment-to-moment awareness, as well as accepting those thoughts and feelings that come up without judgment. So instead of getting caught up in sort of the spiral of depression or anxiety that often happens, where I go, oh, I feel so bad, and then, oh my gosh, I feel so bad that I feel so bad because now I'm making my parents upset, and now I'm making my siblings upset, and oh, I feel even worse now. Rather than that, mindfulness would be something like, oh, I feel pretty bad. Okay, I guess I feel bad. And just ending it there, just being aware of that and where that comes from. And then it becomes moment to moment, and you can notice times when you aren't feeling bad, and that starts bringing you out of it. So with that, it seems like less mind wandering actually is correlated with increased happiness. So the more present you are, even with commuting to work or whatever it is that you're doing in the moment, can increase your happiness if you're feeling present in it. And it seems to help with adaptive stress responses and coping. And these mindfulness-based stress reduction interventions have been used to help physical and well-being among healthcare clinicians as well as clients of healthcare clinics. So it's not just great for our clients, it's good for us too. And then savoring, remembering to sort of relish those really nice moments and feelings as they're happening and enjoy them. And that's making that conscious decision to be present. And then flow is when a person is doing an activity and is really just immersed in that feeling of doing it. So you're so engaged that you aren't really thinking, you're just playing music, or you're writing, or you're painting, or you're gardening, or whatever it is, you're walking, and you aren't thinking too much, you're just fully energetically involved in that activity. And then self-compassion, self-compassion is really important in this as well, and that that may be actually an important part of the whole mindfulness concept, is that we're being kind to ourselves, and instead of judging ourselves for having these feelings or these reactions, we're accepting them and being kind.
Annie, I think a lot about, you know, this new, I mean, people are calling it kind of a new field of mindfulness, but that concept of mindfulness goes back for a lot of indigenous communities as very core belief systems around, you know, being here in the present and being, you know, putting your feet on the earth and being here in this moment. And oftentimes I think, you know, even for myself, you know, you get caught up in the stresses of things and all the stuff that's happening, maybe personally or professionally, and you really have to kind of redirect your mind when it starts to wander. And so part of that mindfulness is just recognizing, oh, my mind's drifting. Let me get myself back to the present to notice what's going on around me. And I think part of the mindfulness piece, too, is that when you're living in your head, either in the past or in the future, like maybe you're worrying about what's coming down the line tomorrow or the next week, or you're worried about problems coming up, or maybe you're kind of concentrating on hurts or past pains or things that have really kind of bothered you in the past, then you don't have the opportunity to learn, because learning happens like right here, right now. And so I think part of that mindfulness is also remembering that when you're here in this moment and you keep your mind here in the present and you're paying attention to what's going on around you, then you have a much bigger opportunity to learn and to grow as a human being. And, you know, that I really also do appreciate the concept of flow, because it's really, and I've always heard people describe it to me as like, it's that idea of you're doing something and you lose track of time because you're enjoying it so much, or you're in such on such a roll with it. It could happen, you know, any kinds of things you do. It could be dancing, it could be writing, it could be whatever, but you just do it, and your mind's not really thinking about anything else than what you're doing. And that flow creates a good energy for yourself in terms of kind of distracting yourself from some of the life challenges, and you know, the more flow that people get into. And I always recommend people do a little bit of flow activity every day, because if you're doing a little bit of flow, it has the opportunity to really energize your mind and kind of get your mind off of some of the maybe challenging things that you might be, you know, concerned about. So this is great resources for people to think about incorporating into their daily lives.
So then another aspect of improving well-being seems to be around autonomy and identity development. So those people with a strong internalized, what they call locus of control, or sort of belief that you have your own destiny and have a control over your life, are less likely to fall into this learned helplessness. And so again, it's not control as though, oh, I control everything. The control is in they know what they can control and they're good at using that. And they have a sense that they have this bigger meaning. And this makes them really resilient in the face of challenging stressors that would end other people up in feeling like, oh, I can't do anything. But they continue pushing through it because they have a sense of something bigger and that they can do these small actions that get them there. A higher sense of ethnic identity has also been studied among Native American youth, and this is actually pretty, well, relatively big literature for this community in that, and it's exciting because it's showing that there's also, with that, correlated a higher sense of community and a higher sense of positive affect, self-confidence, purpose in life, ability, mastery, self-esteem, and optimism. And these are all things we want in order to both reduce stress, increase resiliency, and increase happiness. So it's looking like, of course, the community has a lot of strengths within itself in terms of how to deal with these stressors in life. And then even in medical settings, they've done examples of, or they've shown examples of how increasing a sense of control among patients can even lead to better health outcomes. So, for example, letting patients administer their own pain medication, instead of administering more, they actually used less because their sense of pain appeared to be less, or their understanding of the pain that they were feeling was less because they felt a sense of control, which helped to make the whole situation seem a little less overwhelming and perhaps less painful. And then they've done experiments in nursing homes, giving more responsibility to the residents in terms of just simple things like meal choice, social activities, and through that choice, the residents actually became more active in social interactions. They self-described themselves as happier. Their health improved, and their mortality even seemed to decline. So even just a little bit of extra control in people's lives over small things like meal and social activities can do a lot. And then another aspect that will help with well-being is, of course, doing things that feel meaningful to you. So it seemed that those who could find the blessings and lessons in the aftermath of traumatic events actually went above and beyond recovery from trauma. They grew personally and saw it as personal growth in terms of their recovery. And so these people who can really look at a challenging event as a learning opportunity and getting the best out of it can grow a lot, even in the face of significant stressors. Gratitude is also strongly related to well-being and can be fostered through really simple exercises like every day write down 3 things you're grateful for. And that has seemed to improve a lot of people's happiness just over the course of several weeks. Value affirmation can be really helpful in a potentially stressful environment. So, for example, in this study, they were giving a value affirmation, sort of letting students talk about their values in class, and that helped, and in a learning situation, and that helped to eliminate the negative effect of stereotype threat among these Black students who are facing the stereotype threat of not being able to learn as well. And so they actually learned just as well as everybody else as soon as they were allowed to include their values in that classroom setting. And then social spending, which is spending money on others, seems to encourage happiness, and happiness encourages pro-social spending. So doing things for others does seem to increase happiness, and then happiness increases your doing things for others. So it's a pretty good positive relationship there.
Yeah, and Annie, I would also add that beyond just spending money on others, that volunteerism was one of the very common factors around looking at happiness around the planet, is that when people are actually giving to something more than themselves, it had very positive effects on people in terms of their sense of well-being, their sense of purpose, and their overall feelings of happiness about their lives and what they were doing. Because that idea of contributing to something bigger than yourself can be quite powerful for people.
Yeah, exactly. And these ones may look familiar. These are things we tell our clients and our patients all the time. Moderate exercise, make sure you have some relaxation time, balanced food, time management, and positive humor. And it's all advice we could use with ourselves as well. So then, of course, social support and engagement are really important for well-being. Social support works as a protective factor against depression and anxiety among those who are facing chronic stress, including mothers with autistic children and many other people who are facing sort of a chronic stressor. And of course, if work is a chronic stressor, then workplace support can actually buffer against that. And so that seems to work in the opposite direction in that it's increasing job satisfaction and life satisfaction. Activities that explore personal values like before in a social setting can increase a sense of attachment and acceptance in a social group. And this small intervention they did, having children write down some personal values they had in an elementary school classroom, actually reduced the racial achievement gap over an extended period of time, I think over 2 years, so that students of color and white students were closer in academic achievement than normally happened during a time period where they weren't having their values included in a classroom. And as we know, many kinds of therapy can help people cope with the effects of trauma and stress. And even with the physiological effects, apparently, because with cognitive behavioral therapy and some forms of meditation, it looks like they actually help to reverse the impact of trauma on the brain, helping the brain rewire and regrow to cope with more of the parasympathetic response of sort of learning how to relax and learning how to grow and learn in a more well way. And some interventions that focus on social support. There are a lot of psychosocial interventions helping low-income families, improving stress coping abilities and behavioral outcomes. And these three that I mentioned are all focusing also on improving child developmental and behavioral outcomes, so sort of long-term intergenerational change. So working with families to deal with the stress of poverty and other things that they are constantly facing. And then, of course, using community-defined evidence. The GONA has been shown to be really effective at gathering of Native Americans. And Maria Yellow-Horse Braveheart has done quite a few interventions on historical trauma. And this one cited here is specifically with the Lakota, but definitely showed a decrease in hopelessness and an increase in joy over time as they were working through and healing historical trauma. And so there are many ways to use traditional healing concepts, traditional knowledge, and community to address complex trauma in creative and individual ways.
Annie, I just wanted to, I think this is really an important slide to really think about how, and particularly for those of you participating on the call, you're likely coming into your work with your own histories and experiences. And, I think if you all don't know what your ACE score is, I highly recommend that you check out to find out what your ACE score is, because I think as we're serving communities, it's important that we're keeping ourselves in balance and that we're also seeking help when we might need to get some support from, healing and recovery from traumas, whether they be current or historical or recent or whatever. And so I think what I would do is just really a call to action for folks. We're going to have a link to the ACE website so you can check out to find out what your ACE score is. And if it's quite high, you might want to consider finding some supportive interventions that can help in your process for healing from that, from whatever those things were, and really supporting you in terms of your own balance and well-being. So I appreciate you putting up interventions, and there's a lot of interventions through mental health care, but again, I like the fact that you're discussing these interventions that are community-based and culturally based that can be very useful in supporting people's recovery process.
Mm-hmm. So we have some resources here for people to check out, some different documentaries as well as books and a couple of websites and videos to watch. So we hope you can check some of these out and feel free to ask us further questions on this topic.
Yeah, and I did want to bring some attention to the medicine wheel assessment. That's something we'll be including following the webinar for those that are interested. It's a great little assessment that's focused on mind, heart, body, and spirit, and really it's kind of an assessment of your own life, and a tool to kind of assess where you think you are on those things, and then support in thinking about how you want to move forward in improving your well-being or your balance in some of those areas of life. So I would highly recommend you all, in addition to doing your ACE score, is to do the medicine wheel assessment just for yourself, and maybe it would be useful for other families that you're serving as well. So there's the link to the ACE study, and that's where you can go in and find out what your ACE score is. And then I really do appreciate some of these other resources that are really focused on positive psychology, and I'm a big fan of that Happy documentary that you can get on Netflix. It's a nice documentary that kind of overviews a lot of the research around the globe and shows communities around the globe that have high rates of well-being, subjective well-being and happiness. So I really recommend that you guys take some of these resources and really use them both personally and free, of course, within your work setting and supporting happiness and health and well-being within the families that you're serving.
So now we'd like to bring it back to you all and see how, if there were things that came up for you while we were talking, or and questions you had about the topics, or things that you might have wanted us to address and we didn't get a chance to address yet.
Yeah, and what we're going to do at this point is we're going to go ahead and open up the lines and allow you all to either ask questions or make comments, and feel free to share if there are other learning topics that you'd like us to go into more depth, because, you know, as I shared in the beginning of this webinar came from the real needs of many of the staff of urban Indian health programs that have been reporting to us high levels of stress, high levels of trauma in the community, challenges with burnout, turnover, and all of these kinds of things. And so we're really hoping that in the upcoming fall we'll be offering a series of webinars similar to this topic, but going into a little bit more depth in some of these concepts. So if there are things that you'd like us to focus on, please feel free to bring them forward. Many of the ideas we get for future webinars are from these open Q&A sessions where we have the opportunity to hear from you all about what you'd like to see in the future for additional training. So feel free to share with us what additional things you think would be helpful for us to focus on in the future.